To work internal rotation of our hip, we then change our focus to this back leg. So we turn our chest towards the back leg. And what we are trying to get is our rear glute to touch the floor here. If you struggle with this, then what you can do is bring this knee towards the sole of your foot, so they are connected, and then try to drop this glute onto the floor. You won't feel as much of a stretch in this position. You'll feel that your hip is internally rotated from there. So same protocol as the external rotation. We spend 2 minutes in this position, adapting to our end range of movement, and then we start our PAILS and rails contractions. As we did with the lead leg, to start the PAILS contraction, we build full body tension, so everywhere squeezed to 100%. Our PAILS contraction, which is the first one, is then driving the knee and the inside of the ankle down into the floor. Rather than thinking about just pushing down, we also want to think about that hip internally rotating as much as we can. So 20-second push, and then after the 20 seconds we maintain that tension, switch to our rails contraction and do the opposite. This time Rachel is trying to actively take her hip into more internal rotation. So the way to think about that is, whilst this glute is still pushing into the floor, we're trying to lift this heel off of the floor. Again, 20 seconds, ease that tension, repeat for another round, and then hold for a minute in our newly acquired range of movement.